Before we begin, Aiden, I just need to get your consent on video that you agree to this to be videotaped for my health assessment class.
Yep.
All right. Hi, Aiden. My name is Kathleen. I am going to be your nurse practitioner today, and we are going to be performing a head, ears, eyes, nose, throat, and respiratory exam. How are you?
Good.
I'm washing my hands, putting on some gloves. All right, we're going to begin our exam with a visual inspection of your head, your face, and your neck. So your head looks symmetrical. Your face is mostly symmetrical. There is a slight asymmetry of your left brow and left eye. Otherwise, there are some active acne lesions with some old scarring. Your facial hair is well distributed. Your hair is very healthy looking with a very healthy looking hairline. We're just going to quickly look here at your scalp. I see no flaking, no signs of lice. I'm going to look at your neck, which appears symmetrical. The thyroid cartilage is visible. All right. So first, I actually will inspect everything now by palpating. So first, we're going to palpate your skull. And while I'm doing that, I'm just going to feel different areas of your scalp as well. Great. And then I think no lesions, no bumps, no indents of any kind. So then we're going to move your hair. We will then inspect around your jaw. No redness, no edema. And now I'm going to really assess your jaw for alignment. So I'm going to put my fingers right here. I'm going to have you open and close your jaw. It feels symmetrical. There's no clicking noted. Jaw seems aligned. Any discomfort with that?
No.
Excellent. All right. So next, I'm going to palpate, honey, your lymph nodes. So we're going to palpate here in front of your ear for pre-auricle, and then we're going to post-auricle behind your ear here. If anything is tender, please let me know. All normal so far. Tonsillar, submandible, submental. And then we're going to palpate the anterior cervical spine, posterior, and your occiput. And then I'm going to palpate the deep ones here. If you can turn your head in one direction. And then if you can turn your head in the other direction. Normal. Now I'm going to palpate the supraclavicular area. And then I'm going to palpate intraclavicular. All right, all normal. Here I'm going to palpate your anterior spine, posterior spine, all the way down to T1. And then I'm just, anything tender or sore there?
No.
All bony prominences feel normal, no masses. And then I'm going to check your cervical muscles. Anything tender or sore?
No.
I feel no spasms, no lumps. All right. Now I'm going to check the range of motion on your neck. If you can tilt your head backwards, if you can tilt your chin to chest, and if you can turn your head right and left for me, excellent. If you can tilt each ear down to your shoulder, and then the other side. Anything tender, sore, or stiff?
No.
No? Perfect. All right, now I'm going to just assess the trachea. Put my fingers here. Trachea is supple in midline. I feel no abnormal lumps on it. And I'm going to assess your thyroid. If you can just swallow for me. Excellent. Feels symmetrical, no lumps, lesions, hypertrophy. All right, so that pretty much is our head and neck. We're now going to move on to your ears. So we're going to peek at both ears. They appear symmetrical. There is no redness or edema or deformities. I'm just going to see now if there's any tenderness by pulling. Do you feel any? No.
No.
Let's pull down. And then I'm gonna just push in on your tragus. Any discomfort?
No.
And then just gonna feel your mastoid. Any tenderness?
No.
All feels very normal. Now I am going to test your hearing. So I'm going to whisper some words and I just want you to repeat what you hear. Applesauce.
Applesauce.
Happy day.
Happy day.
All right. Now I'm going to take my tuning fork and we're going to assess for hearing with the Weber and Rhine test. First is the Weber test. I'm going to set off the tuning fork, put it on your forehead, and I just want you to tell me which ears you hear the noise in. What ears?
Both.
Excellent. All right. Now we're going to do the Rhine test, looking for bone conduction and air conduction of hearing, okay? So again, I want you to tell me when you hear the noise stop.
No. No.
We're going to do the exact same on the opposite ear.
No. No.
Okay, based on that, I would say that your left ear has much better hearing. It had about a 2-to-1 difference in bone conduction and air conduction, where your right ear seemed to have a similar time for conduction. So now, if it's okay, I'm going to look inside your ear. So turn the light. I'm going to pull your ear up and backwards to straighten out your canal. While I'm looking here, everything looks okay in the outer areas. All right, we're going to look inside. I see some earwax within the canal. Great. I can now visualize the tympanic membrane. Are you comfortable?
Yep.
It is a pearly gray. Cone of light is an appropriate area. There does not appear to be any bulging. Malleus is within normal. No erythema or edema noted in the canal. All right, I'm going to do the same to this ear. I'm going to hold your ear up and back to straighten out the canal. Gently insert. And give me 1 minute. There's the tympanic membrane. This one is actually easier to visualize. Again, earwax in the canal. No redness, no edema. Malleus within normal limits. Ear is pearly gray. No bulging. Appropriate location of cone of light. All looks good. Next, I'm going to inspect your nose. It is symmetrical. There's no drainage, no redness, no lesions. Tell me if anything hurts when I touch.
No.
Go down here. Great. I'm going to push on your frontal sinuses. Tell me if there's any tenderness.
No.
Maxillary. Any?
No.
Could you occlude your right nair and take a breath in and out? And now occlude the left nair and take a breath in and out. Great. Nasal passages are patent. Next, I'm going to inspect inside. Might be a little bit uncomfortable. If you can just tilt your head back slightly, and I'm just going to push up on your nose, and I'm going to inspect. Turbinates are normal. I see no polyps. It is red mucosa, no drainage noted, and septum is normal. I'm going to do the same now to the other side. Again, I'm going to hold up your nose, fit it inside, tilt downward, and same. Turbinates are normal. No drainage. Septum appears normal. Next, we're going to inspect your mouth. Your lips are symmetrical. They're moist and pink. No cracking, scaling, no lesions noted. If you can open your mouth, we're going to look inside. Your gums are pink. All of your teeth are intact. No cavities visible. If you don't mind now, honey, I'm going to depress your tongue and check the inner structures. Your mucosa looks good. Your tongue, pink, not coated. If you could say ah for me. Uvula is midline. Tonsils are a +1. The soft palate, all intact. And now I'm going to inspect the ducts under your tongue. I apologize. Going to push it down. Ducts. Everything looks good. And now I will just do a manual feel for any. I just apologize. Feeling under the tongue. Good. All right. No loose teeth. We're good. All right. Next time I'm going to illuminate your sinuses, your frontal, and then I am going to have you open your mouth. Perfect. And then do this side. Perfect. All right, next we're going to look at your eyes. So your eyes are slightly asymmetrical, again, with the eyebrow bone and a slight lower lid on the left eye. So I'm now going to look at your conjunctiva and your sclera. So I'm going to pull gently down on your eye. You have clear tears there in your lacrimal ducts. Sclera is white, conjunctiva pink. Do the same over here. You got pink conjunctiva, white sclera, and presence of tears. Now I am going to just look at your cornea, irises, and lens real quick. Shining a light. Everything looks good. Now if you can look straight ahead, I'm just going to check pupillary response. Pupils are slightly unequal. The right pupil is about a 5 and the left pupil is about a 4.5. There is pupillary response to light in the opposite eye, and the left eye constricts. I'm checking the other eye. Again, I see a response in the opposite eye. And now we will check again, and your eyes react. So now I'm going to shine this forward and look for accommodation. If you just look straight ahead, eyes are slightly disconjugate with the light reflection slightly more lateral in the left eye. Now, I'm going to check your peripheral vision. Just tell me when you see my fingers.
No.
And then again.
No.
All right, now I'm going to check ocular eye movements if you can follow my finger. Very good. Now keep your eyes focused on my finger as I move it towards your nose. Eyes both turn in towards the nasal bone. All right, now I'm going to have my assistant hold this eye chart 6 feet away. And with both eyes, if you could read the smallest line you can see.
I think the bottom is LTFPH.
Excellent. Now, can you cover your right eye and read the smallest line possible?
I think the bottom again says LTFPH.
Great. Left eye has 20/20 vision. Now cover your left eye and read the smallest line you can.
I think the second to bottom line says CFDHJ.
Perfect. So we have 20/25 out of the right eye. All right. Now I am going to have you look straight ahead. Focus on an object on the wall, and I am going to visualize the interior back part of your eye. First, I look for the red reflex. Perfect. All right. Your optic disc is bright, no paleness, there's no hemorrhaging. No abnormality of the cup. Arteries and veins are visualized. Perfect. Now if you can look into the light for me so I can look at your macula. Perfect. No hemorrhages or lesions noted. Going to look at your other eye. So if you look straight ahead to an object on the wall, perfect, red reflex. Just gonna move closer. Perfect, there we go. Optic nerve is normal color, there's clarity, no hemorrhages, vessels, arteries and veins visible. Now if you can look into the light, macula is normal, no hemorrhages or lesions. All right, next we're going to assess your respiratory system. So looking at your chest, you're breathing normally, no signs of distress, no accessory muscle use, no retractions. I'm going to assess for symmetry here, honey, by putting my hands on your chest, deep breath in and out. Good, they feel symmetrical. Next, we're gonna assess upper airway sounds. If you can say 99.
99, 99, 99, 99, 99, 99, 99, 99.
All right, and I'm going to just percuss. And if you could lift your arm. All right, if you lift your other arm. All right, we'll do your posterior chest afterwards. Right now I'm going to take a listen to your chest. If you can just take deep breaths in and out. Excellent. Now if you will just turn in the chair for me. And I will take a quick listen to your chest, in and out. Just breathe normally. All right. Now if you can say 99 again for me.
99, 99, 99, 99, 99, 99, 99, 99, 99.
All right. Now if you can hold your hands out in front of you and cross them in front of your chest, we're just gonna palpate. All right, now with your arms still up, if you could take a deep breath in for me, exhale and hold it. Okay. I'm just going to put a little mark on your back here. All right, now exhale, breathe normal. And then when you're ready, if you can take another breath in for me and hold it. Right there. All right, the difference is about 3 centimeters. All right. Now, I'm going to do one last test, which is if you take a deep breath in for me and exhale. Excellent. All right, that's about it for our exam.